I know that having skin cancer or developing skin cancer might be a scary subject for a lot of people, but educating yourself and feeling comfortable with your doctor is the best way you're going to get through it. Today I'm going to educate you on the different types of skin cancers, treatments, preventative measures that you can take as an individual just to stay safe and to feel comfortable with your body. So the first skin cancer that I'm going to go over is actinic keratosis, and it's a precancerous skin condition caused by the exposure to sunlight. Like most cancers are, sunlight is a big issue when it comes to your skin. The next one is basal cell carcinoma. It's a tumor that arises from the epithelial cells of your epidermis, which will be the top of your skin. Melanoma, which is a very common cancer. It's a malignant cell tumor that arises from pigmented cells from your skin. The next one is Kaposis sarcoma, which is KS, a form of skin cancer characterized by the formation of purple and brown patches that arise from your skin. And this is usually a sign that someone may have AIDS or may be suffering from AIDS. Squamous cell carcinoma is a skin cancer that arises from the epidermis skin. Usually appears as firm, red, elevated scales, and it grows very slowly, so most people can catch that in time. Next, I will explain some of the most commonly used types of cancer removals that are available. Courage and electrodesiccation, so usually used for small lesions, small cancer abrasions on the skin. The growth is scraped off with a curate, which is just a sharp knife, and then the area is desiccated or burned with a needle. And I know a lot of these sound very abrasive, which you need to be with skin cancer because you want to get rid of it as fast as you can, get it over with, and then go on to protecting your skin for the future. The next cancer removal is Mohs micrographic surgery. It's the removal of a thin layer of tissue containing tumorous cancer cells. They put it under a microscope in the lab, and then if the skin that they removed at that moment is present for cancer cells, they'll go back and remove another layer of skin and keep continuing the process under the microscope until there are no cancer skin cells available under the microscope. So when you can't see any more skin cells, that's when the process is done. The next one is incisional surgery. It's using a scalpel to remove the entire growth and the border around the growth of normal skin, just as a safety precaution. So they get rid of all the tumors, cancer cells, along with a little bit of normal skin, just for the safety of the surrounding skin so it won't come back. Radiation, which is a lot of people commonly know, it's x-rays directed through the skin to the tumor to shrink the tumor or remove the tumor within several treatments. So this probably won't take one time. It will take up to, you don't even know, hundreds of times just to remove the cancer, depending on how abrasive your cancer is and how fastly you need to get rid of it, how big it is. A lot of things differ when it comes to radiation. And then cryosurgery is tumor tissue is destroyed by freezing the growth with liquid nitrogen and a Q-tip. So those are a couple of the cancer removal treatments that are available. Some preventative measures in the future that you should take if you've had cancer, if you're trying to stay away from cancer, is always wear SPF, a high SPF. They say higher than 15 is good when you're outdoors. Stay away from direct sunlight, sit in the shade. That's always a good thing to do. When you're little, your kids, your grandparents, you as a person, just try to avoid direct sunlight. Avoid using a tanning bed or anything dealing with direct UV ray light, so tanning outside, tanning in beds. None of that is good for your skin. Cover your body with appropriate clothing. If you already have cancer or if you've had cancer removed, you do not want it coming back. So the number one thing would be to protect yourself always. Wear long sleeve clothes, long pants, turtlenecks if it's appropriate, a hat, sunglasses, whatever you think is best for your skin type. Examine yourself. If something does not look right, you can call your doctor immediately and make an appointment and then see your doctor at least once a year. All these things are easy to do. You can do them in a minute. You can do them over time. Like, call your doctor, stay out of the sunlight. These are all things that you can do as an individual. You can choose to do them or choose not to do them. But you want to protect your skin, and you, as an individual, do not want skin cancer. And I know it can be a little scary, but there's always steps that you can take to prevent skin cancer. Anybody can be at risk for skin cancer, but people who are exposed to UV ray lights are more at risk for skin cancer than people who use preventative measures. Along with those people, if you have fair skin, you get sunburns easily or have a history of getting sunburns, live in higher altitudes, you're closer to the sun, you can develop skin cancer. If you have moles, you just got to watch out for those. Those are usually places that skin cancer can form. Have a family history of skin cancer, that's always an issue. You know, your genetics play a role in everything you do in your life. So just watch out for that kind of stuff. And the last thing, I would recommend that everybody look over their bodies every couple of months to see if anything looks any different. I know this can be kind of awkward or you can be nervous, but this is the best way that you can know and your doctor can know how your body's acting, how it's reacting. Feel your moles if you have them. Make sure they're just round, small, nothing abnormal about them. Use a mirror. Look at the back of your legs, the back of your arms, your back in general. Make sure that there is no abnormal moles, freckles, patches, any kind of that on your back, as well as your front. If a mole or freckle has grown in size, appearance, or has changed in color, call your doctor immediately to get it checked out. It could be a precursor to skin cancer. And then if you feel like something might be wrong, get a second opinion. Ask someone in your household what they think. Call a doctor, make an appointment. You know, anything that makes you feel comfortable with your body is very acceptable. So I hope you were informed well today, and if you have any questions, always call your doctor or your physician and make an appointment, get it checked out, because skin cancer is something that can be taken care of immediately, and it can also be prevented. So remember my tips, and I hope you have a good day.